the things that I've listed are lifestyle related deaths. These things are preventable. Like if we had a public health campaign where you had the president of the United States telling everybody that it was mandatory that they eat their vegetables, they encouraged employers to make sure that there was a serving of vegetables in everybody's lunch, right? That you had to get a vitamin D test before you came back to work after you've been sick. If we looked at those kinds of things in a public health context, man, I'll bet that our quality of life would radically change in this country. I think attacking people who promote these kinds of things not only is silly, I think it's un-American. I think as we talk about the ability to read research and then get called unscientific, I think that if you have that First Amendment right to call somebody like me or my friends who are in the dissenting or disinformation dozen unscientific, you're talking to MIT grads, you're talking to medical doctors, you're talking to nurses, you're talking to people who have taken care of patients who have gone through the medical route and saw their health deteriorate in front of them, got recovered by stuff that they've done. And now you're pointing fingers at them and saying they're responsible for the reason that people are dying. I think that's silly. If you have high blood pressure, kidney disease, cancer, risk of stroke, these are the factors that we've always associated with elderly people at being risk for COVID. According to a Health and Human Services mega study with over millions of cases of looking at this and trying to predict which cities, which states, counties, countries even are at risk, they came up with some interesting findings. One is that those comorbidities tend not to predict death rates for COVID-19. It was a bombshell they released back in May that I think kind of went underreported. It was a massive study that the Department of Health and Human Services released. They used very, very new data, a brand new database that they constructed to help track comorbidities across the country. So in hospitals, when people were dying of COVID, they came up with some really interesting statistics. They wanted to find out who was at risk. And so they listed these like the heart disease, the chronic lung disease, kidney disease, cancer, who's at risk here for being sick and then hospitalized and then dying from COVID-19. And we had always presumed, well, gosh, these must be the ways that you can help predict this. And so even like I was always telling all of my patients, hey, if you have these things, these are really important to understand. This might be a reason why you might want to choose to do something like get vaccinated, choose to social distance from these people, et cetera. Well, when the study came out, it was one of those things where I read it and I have to change my mind because as I'm reading through the data on it, they were really, really clear that the ability for them to create some kind of prediction model based off of those criteria, it's the most common criteria we've always associated with COVID-19, and age completely overshot the ability for them to predict whether or not people are going to die in an area. What did seem to be a factor were these external things that we've also been talking about, things they didn't track. They didn't track race. They didn't track access to healthcare. They didn't track social economic status. They didn't track all of these things like crowding and the social constructs of different families types of, hey, we have grandparents who live with us. Hey, we take care of our elderly and they live in our home or in our community and we see them really often. These things weren't things tracked by the brand new database system. And so Department of Health and Human Services said, listen, we've got a lot of other factors looking at this data that we have to be aware of. They compared the death rates in places like West Virginia, where people did have these comorbidities, with places like Utah, which is a younger population who didn't have, although they had some of these same comorbidities, didn't have the death rates. They said, hey, listen, they've got more space out there. They've got more ability to have access to really good health care. And those things tended to be the bigger factors. And so just kind of like anything, whenever we're trying to paint with a broad brush, it just doesn't seem to work real well. They cited a couple other really interesting studies that looked worldwide at people who got sick and died, like by regions of the planet. And some of the studies that they cited suggested that what we would consider kind of your impoverished countries had lower death rates, partially because they had younger populations. They tied in two things. One is the advancement of the economy, and then probably what goes along with that is that people tend to live longer in those places with higher death rates. So places like the United States had higher fatality rates from COVID-19, partially because we live longer. Places like Mexico had lower rates, even though we share a border. And so when we're looking at these kinds of factors about who is at risk, we can identify some pretty interesting things. One of those studies identified obesity as being one of the factors. It's something we've been talking about for a long time. As I was talking about the things last year that I hoped would change in this country, how we eat and how we exercise, whether or not we go outside, I said all of those things were going to be super important. I said that you're going to expect things like surges in the Sun Belt states in the summertime because it's 90 flipping degrees here and we don't go outside. It's hot. We don't take our kids outside. We don't bring our elderly outside. My son went through 4 bottles of water over the weekend just because we were playing. And that's a lot of water for a little kid because he was sweating a lot, right? And so a lot of people just tend to play indoors at some of those bounce places. So that's part of what we're trying to figure out. We're trying to figure out regionally and geographically who really does need to pay attention to some of these social distancing measures, masking mandates, vaccinations, all that kind of stuff, because it appears that some people are actually doing okay because of their actual environmental situation. It provides a protective effect when you live out on a farm and you work outside every day. If you're able to eat good food, if you have access to that kind of stuff, if you have the money to eat organic and to take supplements, and that's stuff that you're doing on a regular basis, that changes the game for you a bit. But we don't have, from a public health standpoint, really good numbers on this stuff. And so it's hard to report it. So it's much easier to give everybody a big broad brush and say, hey, listen, these are the risk factors. You know what I also looked up as I was curious about it was the 10 leading causes of death in the United States in 2020. COVID killed 340 some thousand people last year, ranked it as the third leading cause of death according to the CDC. Now, we have, again, I've reported this over and over again, all the way back when I was doing Guerrilla Health Report a decade ago, that the To Err Is Human report that came out in 1999 from the AMA, and then followed up again in 2010 and again in 2013, which looked at iatrogenic deaths in the United States. Iatrogenic means doctor related. And so there were things like they operated on the wrong limb, or they gave somebody the wrong medication, or they ended up not completing an examination because the patient was overweight. These kinds of things lead to somewhere between 270 to 410,000 deaths every year in this country. That really is the third leading cause of death. But during this time of COVID, doctors were flying really without a plan, right? Nobody had kind of a rule book for this pandemic. And so as they just kind of went, we know that a lot of the deaths that happened were probably just oopsies, unfortunately, right? And they got CDC recommended, said all deaths when you have a COVID positive test have to be listed as COVID. They mentioned this in the HHS report. They said, hey, we didn't have data on some of these people. They left the form blank for comorbidities, so we just presumed they had none. And they said that that was probably an error in some of their statistics as they were looking at this. So we were just like inundated with cases in the healthcare system and didn't know what to do about it. And so we kind of give everybody a hall pass as far as do the best job you possibly can, save as many lives as you possibly can, and then we'll sort the data out later. Well, here's how the data is sorted out. Those comorbidities that I have mentioned. So again, I want to go over them. Heart disease was the number one killer in the United States. We had an increase in heart disease in 2020 that was higher than we've seen in the last, since 2012 is what the report said. Killed about 10% more people than it did the prior year. Cancer, still number two killer in the United States, close to 500,000 people. The number of people who died from cancer last year actually went down by 0.01%. We look at chronic lung diseases and kidney diseases. And if you put all of those things together, those comorbidities that we usually associate, just those four, right? It killed 4 times as many people as COVID did in 2020. So a couple things, you've got to ask the questions, right? Did more people die because the hospitals were just way too busy taking care of COVID patients? I mean, that's a possibility. And it's just something that we have to come to accept as a country, that we lost people just because we were overcrowded. In the richest health system in America, on the planet, that's how we did, right? The other possibility is that, vaccines don't prevent these things. That is a reality check for a lot of people, that you can go ahead and get your 2 shots. And I highly recommend it for those of you who wish to do that. But please be really aware that the things that I've listed are lifestyle related deaths. These things are preventable. Like, if we had a public health campaign where you had the president of the United States telling everybody that it was mandatory that they eat their vegetables, they encouraged employers to make sure that there was a serving of vegetables in everybody's lunch, right? That you had to get a vitamin D test before you came back to work after you've been sick. If we looked at those kinds of things in a public health context, man, I'll bet that our quality of life would radically change in this country. I think attacking people who promote these kinds of things not only is silly, I think it's un-American. I think as we talk about the ability to read research and then get called unscientific, I think that if you have that First Amendment right to call somebody like me or my friends who are in the dissenting or disinformation dozen unscientific, you're talking to MIT grads, you're talking to medical doctors, you're talking to nurses, you're talking to people who have taken care of patients who have gone through the medical route and saw their health deteriorate in front of them, got recovered by stuff that they've done. And now you're pointing fingers at them and saying they're responsible for the reason that people are dying. I think that's silly. And so what we're doing here is now making sure, and every single one of the times that I talk on camera, and I'm going to talk about things like COVID, that I am giving you the government issued information. So you're going to get reports from Health and Human Services. You're going to get the link straight to the CDC's mortality and morbidity weekly report, because I read the darn stuff and I want you guys to see it. So that's where I'm at. I mean, at this point in time, I've gotten so fed up with how people are treating each other over this, the bullying campaigns, the pressure campaigns, because people pretend that just because someone says something on television, that must be right, and they don't fact check themselves. We have a terrible history of fact checking ourselves in this country, and I'm getting kind of over it, because a lot of my friends, a lot of my patients are getting so much stress and drama from other people that it's time to kind of stand up here. It's time that you read the own research that your own government is putting out to you so that you can see what the facts actually are. And so I'm going to give them to you. And if you want a good source of trusted health information, regardless of videos like this that get a little CDC label, well, good. Go to the CDC website. I want you to read this stuff, because I'm going to cite it for you too. I'm going to highlight the important parts so that you can make informed decisions for yourself, because that is your personal responsibility. That is a responsibility of the government to go ahead and give you good information. And that's our responsibility as a culture, to be able to take care of one another and let people have the opportunity to make their own decisions for themselves. So I hope you keep on tuning into this One Belly, Two Brains. You can tell I get really fired up about things like autonomy. And if this is information that you think other people would want to hear, make sure you share it. We come to you every single week on Instagram TV. We broadcast on YouTube. We broadcast on Facebook. As long as I'm allowed to, I'm going to keep on doing it. If I have to switch over to email, then so be it. I know a lot of ways to do that stuff. So I'll look forward to seeing you next week. Until then, I hope you all take great care.